Welcome to Solshine Wellness Group. My name is Dr. Ravyn Ramos. I'm a naturopathic physician and a board-certified nurse practitioner. I went to Bastyr University and I graduated in 2009. I have advanced training in both family medicine and functional psychiatry. I decided to pursue dual training because as a patient, it always felt like there were various realms of medicine that seemed to operate in silos. I obviously wanted the least invasive, most effective solution to any issue I might be facing, be it more naturopathic or more traditional, so to speak. I just wanted to get better, and I just wanted to know who could help me. It truly felt like there were all of these different branches of medicine and all of these different titles that didn't necessarily fully understand one another. And as a patient, for me, that was very confusing and overwhelming. And so because of that, I decided to become that doctor that could really embrace and speak to it all and bridge that gap for my patients. I really wanted to be able to team with them to make solid, evidence-based decisions for their health, but with an open mind. Over the years, I've worked in a wide variety of clinical environments, and it's given me immense experience. I've worked in community and tribal health, I've worked with veterans, people with addictions, and all kinds of physical and mental struggles. I've worked and lived internationally. I've seen and treated a wide variety of illnesses and helped people from various cultural backgrounds heal from the dis-ease that was troubling them. Over time, I've found that functional medicine, meaning medicine that really looks deeply at how the body actually works in order to figure out the problem and fix it at its root, is really the best approach to healing for my patients. And my specialties within functional medicine are both general family practice and functional mental health. The reason I chose to concentrate in these two particular areas is because over time I've realized that the body and the mind are inextricably linked. So when we look at disease in the body without considering a person's emotional wellness, we will invariably risk missing key elements that may be contributing to their illness. Likewise, when we solely focus on someone's mental health, without looking at their physical health, we're also operating with blinders on, so to speak. So this brings me back to those silos again. It's important for me to look at my patients holistically, and that includes considering both of these factors at the same time when trying to understand the cause for someone being unwell. Consider this. Many people come to me with depression, anxiety, chronic stress, grief, PTSD, childhood trauma, unhealed wounds. These are the burdens we carry that affect our day-to-day functioning. Likewise, many physical issues seem to be connected to emotional imbalances. Think thyroid issues, hormone imbalances such as PMS, perimenopause, absolutely affect our mental health. Which comes first? Ultimately, it doesn't really matter. We have to look at both. I treat both psychological conditions and physical conditions from a functional medicine perspective using whatever makes the most sense for that patient. That could be natural substances, supplements, onto the latest medications, whatever seems necessary to best treat that person's condition. Look, I'm a busy mom. I work full-time. I completely understand the burnout and fatigue and overwhelm that we all face. And sometimes we know what we need to do to feel better. It just doesn't seem accessible. It just seems like one more thing on our plate. I want not only to dig deep to figure out what we need to do to get you better emotionally and physically, but I want to make it something that feels accessible to you, where you are today with all that you may have going on. And then together, we'll make goals to optimize your health little by little and keep you there. Welcome to Solshine. We're so happy to have you here.